child health nursing subject in that chapter 6, that is the children with various disorders and diseases. Okay, in that the childhood stage or in the age group of children, the children are suffering with the one disease condition, that is the asthma. Okay, asthma is a one type of respiratory system disorder. Okay, in that respiratory system, what are the organs is there? Okay, how we are taking respiration. Okay, that regarding that, in that respiratory system, that organs is the nose, okay, in that mouth or pharynx, larynx, okay, trachea, bronchi, bronchioles, next lungs. Okay, these are the organs. Okay, respiratory system divided into upper respiratory system and lower respiratory system. Okay, in that upper respiratory system may be affected by any diseases, means the virus or bacteria will be enters through the upper respiratory system, it will be leads to the or it will be reaches lower respiratory system of the children. Okay, the asthma is a one disease condition of lower respiratory system in the children. Okay, here once we are taking oxygen by the inhalation of air, okay, in that oxygen will be receiving and the oxygen should be pumping or transferring to the all tissues of the body. Okay, along with blood also sending to the capillaries. Okay, in this respiration and inspiration process, we are called as the one breathing. Okay, here once the children are suffering with the one this disease condition, means the children may be suffering with the one symptom like difficulty in breathing. Okay, here asthma. What is meant by asthma? Means asthma nothing but this meaning is the struggling for breathing. Okay, many of the children their normal breathing pattern should be so much of struggles or problems is there in the breathing. Okay, they are not taking proper breathing, proper respiration. Why? Because some abnormalities, some fluid accumulation, okay, some infection is there in the bronchi. Okay, next it will be leads to the definition of asthma. It is defined as chronic inflammatory disease to the bronchi. Okay. Okay, chronic inflammatory disorder to the bronchi. Okay, especially in the lower airway. Why? Because due to the temporary narrowing of bronchi. Okay, not permanent narrowing. Narrowing nothing but obstruction. Okay, simple term. Now this asthma is defined as difficulty in breathing due to the some temporary or structural or functional abnormalities of the bronchi. Okay, there are bronchi having some structural abnormalities or functional abnormalities. What is the normal function? Means in the bronchi having the some cylindrical structure that will be receiving some oxygen that will be sending to the some capillaries. Okay, this is the normal function. Here once the bronchi should be affected by any viruses or any bacteria, due to that infection the bronchi should be lost their normal functioning. Okay, this is the definition of asthma. Next incidence. Okay, who are prone to get this disease or who are high risk for this disease means many of the children 5 to 10 years of age group children. Okay, many of the 5 to 10 years of the children will be suffering with this disease of asthma. Okay, next sometimes major incidents to the major risk to the boys than the girls. Means the girls are low risk for this asthma disease condition. Boys are high risk for this asthma disease condition. Okay, next we are going to discuss about causes for the asthma disease condition. Okay, what are the reasons why the breathing difficulty is there in the children? Means here first reason, that is the hereditary. Okay, in the family the family members are having in their childhood stage or in their lifetime they are having this asthma disease condition, means this disorder may be prone to get or this disorder will be easily spread or easily come to their offsprings or third generation of people. Why? Because through the chromosomes or through the genes. Okay, through the genes, by the genes, the children may be prone to get this disorder of asthma. Okay, next another one is the due to some of allergens. Okay, what are the allergies? Means inhalation of some pollens or inhalation of some type of drugs or some cosmetics or some thickness of medicines or some type of smoke or sometimes chalk piece powder also leads for asthma in the children. Okay, excessive exposure to the dust or air, unhygienic air or contaminated air or sometimes wooden powder. Okay, the children or excessively inhalation of this unpurified air. Due to these reasons also the children will be struggle for breath. Okay, next another reason like injection of food. Okay, excessive food like many of the children continuously eating that non-veg like eggs or the fish. Okay, or meat. This is also one reason for children may be prone to get one disease of asthma. Okay, next another one is the children or many of the children interested for eating of chocolates, and another one is some food allergies like they are eating that vegetables food like brinjal. Okay, the brinjal also one allergy. Some children are having healthy. Okay, some children are maybe prone to get some allergic reactions. Means due to that the children may have some cough or some type of allergy on skin, or sometimes they are continuously having the sneezing or running nose. Okay, due to some food allergies the children may be prone to get difficulty in breathing. Okay, they are struggle for breathe. Okay, next another like some of the drugs. Okay, continuously due to the reducing their disease conditions they are using penicillin medication. Means this may be one risk factor for asthma. Okay, sometimes aspirin drug also. Okay, excessive use of these penicillin drug and aspirin drug, this is also one high risk for difficulty in breathing in the children. Okay, sometimes respiratory infections like rhinitis. Okay, or sometimes bronchitis. Okay, inflammation of the bronchi or inflammation of the nasal mucosal membrane. Okay, or sometimes due to some bacterial infection, viral infection, staphylococci, streptococci or mycobacterium tuberculosis. Okay, some type of respiratory infections. Okay, due to these upper respiratory tract infection, it may be leads to the one cause for struggling of breathing in the children. Okay, next another one is the sometimes climate changes. Okay, if the weather will be changed, means excessive cooling of weather or sometimes rainy season also the children may be prone to get this disease of asthma. Okay, sometimes due to the excessive emotions, means the children are having excessive stress or excessive tension, or they are excited for any situations or excessive crying. Okay, sometimes the children are having they are doing some exercises in a unhygienic area or poor environmental status area. Okay, they are doing some exercises means they are inhaling contaminated air. In that air some microorganisms or some bacteria will be inhaled by the nose. Okay, that viruses or that bacteria maybe enters through the nose, it will be reaches lower respiratory tract at the bronchi. Okay, that's why the children are struggling for breathing. Okay, once the bacteria should be enters, once the viral should be enters into the body means immediately their growth and replication should be there. That's why the children may be prone to get this disease of asthma in their childhood stage. Okay, these are the causes. Next we are going to discuss about classification of asthma. Okay, what is the classification? How many classifications is there? Means mainly two types is there. One is the allergic asthma Another one is the non-allergic asthma. Okay, now we will see about allergic asthma. What is meant by allergic asthma? How it will be caused in the children? Means in this allergic asthma mainly due to the immune response, means in the body of the children, inhalation of antibodies, okay, inhalation of antigens by the nose. Okay, once the antigen, nothing but virus or bacteria should be enters into the childhood body, okay, immediately their body will be release some antibodies, especially immunoglobulin G. Okay, that immunoglobulin E should be releases, and here what happens means antigen antibody reaction. Okay, what is that antigen antibody reaction? Means immunoglobulin E and some viruses, some bacteria, they are fight, and here if the children are having low immunity power, means the children may be prone to get one disease of asthma. Okay, next another one is the non-allergic asthma. Here what happens means some other inhalation of cigarette smoking, okay, some irritants, okay, excessive cigarette smoking they are exposing, means immediately they are having a breathing difficulty. Okay, why? Because in that smoke there is no sufficient oxygen for inhalation of children. Okay, that's why the children are struggle for breathing. Okay, next another reason, excessive air pollution. Okay, in that air, contaminated air, means they are not having in that environment purified air not available. Okay, in that air contaminated or polluted air is there, so many of dust particles is there, means when the children are inhaling that dust particles or contaminated air, okay, they are maybe have one irritation in the nasal mucosa and bronchi, they may be prone to get non-allergic asthma. Okay, next another one is the sometimes they are using some perfumes. Okay, many of the children's exposing to these perfumes, okay, due to that acidic nature or due to that hardness in the perfumes, okay, they are struggle for breathing. Okay, next another one is the children's how we are identified the children's or struggle for breathing, means they are having one symptom like bronchospasm. Another one is the wheezing sounds. Okay, they are, when they are taking some breathing or some respiration, they are doing some sounds, wheezing sounds. Okay, next this non-allergic asthma, how are risk by the positive family history. Okay, in the family member, one member may be suffering with this asthma disease condition, means okay, the disease may be easily spread to their children. Okay, next another one is the some type of viral respiratory infections. Okay, especially due to the viruses, the children may be prone to get one disease of asthma. Next another one is the we are discussing some emotions or some type of stress or anxiety, okay, or poor personal hygiene, poor environmental status, okay, unhygienic area, the air should be polluted or contaminated air when they are inhaling, okay, the fresh or sufficient oxygen is not available in that particular area. Okay, that surrounding area will be complete contaminated by the smoke or dust or other particles. Due to that reasons, the children may be prone to get this disease of asthma.